Hello, everyone, and thank you all for joining us during the Lytham Partners Fall 2023 Investor Conference. My name is Adam Lowensteiner, Vice President of Lytham Partners. During this presentation, we welcome Reliq Health Technologies, ticker symbol of RHT, that is Robert Harry Thomas on the Toronto Venture Exchange, and RQHTF, that is Robert Quebec Harry Thomas Frank in the United States, and its CEO, Dr. Lisa Crossley. Before we begin, for all those not familiar, Lytham Partners is one of the country's leading investor relations firms. With more than 2 decades of corporate access experience, we have built one of the industry's most diverse and effective platforms for connecting small cap companies with high quality and focused institutional investors, while creating a framework of best practices in all aspects of investor relations. Today's discussion is hopefully yet another example where we could bring value to multiple constituents. We will begin the discussion in a moment, but one final item, I want to remind everyone that Reliq will be available for one-on-one meetings after it reports its fourth quarter year-end results later this month. If you have not already signed up, please send me an email at lowensteiner@lythampartners.com or visit www.lythampartners.com/virtual and click the one-on-one meeting request button, and we will aggregate those meetings. With that said, let's begin. Lisa, please proceed.
Thank you, Adam. Again, as Adam said, my name is Lisa Crossley, and I'm the CEO at Reliq Health. We will be providing some forward-looking statements in this presentation, so please review the disclaimer at your leisure. So who is Reliq Health Technologies? We are a software as a service firm, and we're focused on the chronic disease management space in the United States primarily. We have virtual care software as a service solutions that benefit every member of the ecosystem, so from payers to clinicians to patients to the company itself. Our solutions are turnkey, so they allow clinicians to seamlessly roll them out and deliver new billable services to their clients, which in their case is patients. We generate recurring revenue from subscriptions and organic growth as opposed to mergers and acquisitions. And we have strong margins. So we already have gross margins of around 70%. And by the end of 2024, we expect to hit our target EBITDA margins of over 40%. We achieved profitability. So we were EBITDA positive in the quarter ending March 31st, 2023, and have continued to be profitable since. And the company is currently in a period of very rapid growth that we expect will result in record revenues in 2024 and beyond. Some of the recent milestones, really what has changed fundamentally for Reliq over the last 6 to 12 months is the size of our clients. So we've moved from those primarily individual physician practices and home health agencies who are still important clients of ours, but now our primary focus in terms of new client acquisition and where we've had a lot of traction recently is with these larger networks that occupy multiple states and often have a whole range of care settings within their organization. So most recently, we signed a physician network with over 300 locations across the United States. They have over 750 physicians and are expected to add over 100,000 new patients to Reliq's iUGO Care platform by the end of 2025. And the geographic dispersion associated with this client in particular, as well as some of the other clients I'll mention in a moment, really drove our recent capital raise of $6 million, because that's going to allow us to very rapidly deploy these clients who are now in 17 US states and Puerto Rico, the US Virgin Islands, and as you'll hear, we have a client in Mexico. So we really needed to have that rapid infusion of cash to allow us to ramp up very quickly with these clients and make sure that we could meet their needs in a timely manner. We've also recently signed with a leading US healthcare company that has 75 locations in 8 states. And that company in particular has been recognized by Newsweek and US News and World Report as having some of the top long-term care and skilled nursing facilities in the United States in 2022. So a very high-profile client for us. We've also signed a large US healthcare system that has over 1,200 care centers across 7 states, and they offer skilled nursing, inpatient hospital care, home health, hospice care, so very broadly diversified in terms of the care settings. They have more than 10 million patient encounters a year, so it's a very large, very active network. We've signed with a U.S. health plan that operates accountable care organizations, which are groups of family physicians who are primarily focused on Medicare and Medicaid patients and are working together, particularly on the back office aspects of claim submission and dealing with Medicare and Medicaid. They typically operate on a shared savings model, so they're very focused on health outcomes and keeping patients out of hospital, which means that their mandates are very aligned with ours. This particular network of ACOs has over 1 million patients, more than 3,000 doctors, and they're a subsidiary of one of the US's largest providers of hospital and healthcare services, who is also a Fortune 500 company. And back in 2022, we signed a large inpatient healthcare organization that primarily does skilled nursing, but some long-term care in hospitals as well. And we've signed 180 of their facilities already. And we also recently signed our first client in Mexico, so expanding beyond the US and taking advantage of our Spanish-speaking care managers and our multilingual platform. Some recent metrics here. I'm not going to dwell on a lot of these numbers, but a couple of points I want to highlight. One is, with the valuation currently around 80 million Canadian, relative to where we expect to end up in terms of revenue at the end of this year and the end of next year, I think we're very conservatively valued. So there's a lot of opportunity for growth here for the company. And with our most recent raise, I myself now own over 3.4 million shares in the company that I either bought on the open market or exercised as options, including 200,000 options that were priced at $1.12. So I obviously have very, very significant faith in the company and tremendous optimism about our future potential. Again, I won't read all of this tiny text, but just suffice it to say that our leadership team is very strong. It's a team of individuals who each have, at least 15 to 25 years of experience in building and leading technology companies and also building and launching new technology products. And the context for our company, last year, the US healthcare costs were roughly $4.4 trillion. So healthcare spending in the US is very significant. And roughly 80% of that spending is on chronic disease patients. So those are patients who have hypertension, which is high blood pressure, diabetes, and chronic obstructive pulmonary disease, congestive heart failure, kidney disease, even dementia. And the reason that these patients are such a huge cost center for the healthcare system is that on a day-to-day basis, they're responsible for managing their own care in the homes. And less than 50% of them remember to take their medication as prescribed. They're coping with often multiple comorbidities, so multiple different chronic diseases. So it's very challenging for them to manage their care on their own. And the Centers for Medicare and Medicaid Services, or CMS, have really moved to more of a value-based, outcomes-driven compensation model. So there are penalties for clinicians whose patients are hospitalized more than the national average, and there are opportunities through shared savings models and through these programs that we support that will allow clinicians to actually make more money if patients are kept out of hospital, because that's what's really costing the healthcare system is the hospitalizations for these patients. So our platform is a multi-module platform. It's very flexible. If Medicare and Medicaid introduce a new billing code, we're able to, within a matter of weeks, spin out a new module that will allow clinicians to deliver those virtual care services through our platform. Our platform not only supports a whole range of different virtual care services, but also secures electronic pre-authorizations through the Medicare and Medicaid databases to ensure that any patient that's onboarded onto the platform is eligible for these programs, and the clinician will be able to bill for those programs if they deliver the services through our platform. We also are able to electronically submit claims on behalf of the clinician. So we really offer a very holistic platform that essentially provides kind of white glove service to those clinicians as well as to the patients. A classic use case for us would be a patient with congestive heart failure. So these patients in the home are supposed to be checking their weight every day, recording it, and then if they notice a 2-pound weight gain, they're supposed to be calling their cardiologist to report a flare-up. But what happens is they forget to check their weight every day, or they forget to write it down, or they forget the threshold where they're supposed to call their cardiologist. So what typically happens when they're left to their own devices is they aren't really aware that there's an issue, that there's this increased fluid load. And so they wait until they're starting to have significant physical symptoms like pain or pressure in the chest, difficulty breathing. And at that point, when they go to the hospital, the issue has become so significant that they're typically looking at an intensive care unit stay of 1 to several weeks. And that's $100,000 minimum, but can be significantly more in cost to the healthcare system. And allowing the condition to progress to that point also often results in permanent damage to organs like the heart, the lungs, and the kidneys. If a patient with congestive heart failure is on our platform, they're reminded daily to check their weight by stepping on the scale. They don't have to record the weight or understand what the change in weight means. That data from the scale is immediately pushed to our platform. So as soon as the patient steps on, that number goes to our platform, and their clinical team is alerted if there's an out of norm result. So if there's that sudden 2-pound weight gain in 24 hours, their clinical care team can call in a new prescription for a diuretic. And that one change alone, sort of getting rid of the fluid for that patient, can keep the patient healthy and at home indefinitely. So these little interventions in the home actually have a dramatic impact on patient health, quality of life, and certainly on healthcare spending by avoiding those hospitalizations. So the benefits of our platform: for patients, we improve health outcomes, we improve quality of life, and we have clinical data demonstrating that we reduce hospitalizations in this population by over 80% relative to their baselines. For providers, we create new revenue streams, and we help them avoid those financial penalties associated with excessive hospitalizations. A typical practice can generate new revenue of over $400 per patient per month by deploying our platform. And since we're only charging between $40 and $100 per patient per month, it's a very high profit margin new revenue stream for clinicians. Our recent revenue growth between fiscal year 2022 and fiscal year 2023, and our fiscal year is July 1st to June 30th, and we more than doubled revenue. We expect again to more than double revenue by the end of fiscal 2024, June 30th, 2024. Our software and services revenues are becoming a more significant percentage of our total revenue relative to hardware. And due to our rapidly accelerating traction with the large US healthcare clients, we're now, as I said, in 17 states, the US Virgin Islands, Puerto Rico, and Mexico, which is really what drove our recent equity raise, because we are now pretty thin on the ground. And so it's important that we're able to staff up, because we do use a train the trainers model. So we do like to have some staff on site for the first few months of a deployment to get the staff at the client site trained, and so that they're able to provide training to patients. For example, if it's a skilled nursing facility, they'll train patients on our platform before they discharge them. And so that helps us get those clients up and running quickly and helps ensure that those patients will be fully adherent post-discharge. So this is a period of very rapid growth for the company. And as I said up front, we expect that this will result in record revenue growth in 2024 as well as beyond. So our growth forecast this year, our focus has really been on adding those large clients. Now that we have all those years of clinical efficacy data and reimbursement data from the smaller clients showing that this platform really works to prevent hospitalizations and that our services are reimbursable by Medicare and Medicaid, we're able to get a lot of these large clients who actually come to us through word of mouth. So as opposed to us having to go out and aggressively sell the platform to the large clients, a lot of them do come in through referrals. And so our focus this year has been on improving patient adherence, maximizing collections, maximizing revenue growth. And I think we've been very successful in that front. Next year, we expect that we'll move to the NASDAQ. We also will be able to start leveraging our large data set and licensing that anonymized, de-identified data to pharmaceutical companies, research institutions, governments, and that will become a significant revenue stream for us in kind of late 2024 and beyond. And we expect to end 2024 at a revenue run rate of roughly $100 million annually. That's calendar 2024. So lastly, the trends and tailwinds in our space. And the future definitely looks bright for Reliq as a company in terms of the overall environment in which we operate. So the population is aging and growing, and that just means that there are more and more chronic disease patients every day. Medicare and Medicaid, as I mentioned, have introduced financial penalties for patients being hospitalized more than the national average. For example, when we're working in Florida, last year, 96% of the hospitals in Florida had readmission penalties assessed to them. So they can lose up to 3% of their total Medicare and Medicaid claims, their total CMS-related revenue for the subsequent year due to those penalties. And by preventing the readmissions, we're helping them completely eliminate those penalties. Since 2018, Medicare and Medicaid have increased the scope of the program. So they've gone from one billing code for remote patient monitoring to 23 different billing codes that, instead of just covering patients with hypertension and diabetes, cover congestive heart failure, kidney disease, in some cases dementia, cancer treatment, and chronic obstructive pulmonary disease, arthritis, other musculoskeletal issues, asthma. So the program has really expanded a lot in terms of the number of patients that are covered. They've also significantly increased the value of the reimbursement. So initially in 2018, it was $59 per patient per month. It's kind of the maximum reimbursement. And now it's well over $400 per patient per month. So Medicare and Medicaid have consistently indicated that they believe this is a platform, this is a program, and this preventative focused, proactive chronic disease management via virtual care that will ultimately save Medicare and Medicaid tens of billions of dollars a year by avoiding those hospitalizations. And that's why every year since 2018, they've expanded the program and increased their investment in the reimbursements, because on the other side, they are saving significantly more than they're spending by just preventing these hospitalizations. That's a brief overview of the company. Thank you very much for your time, and I'm very happy to answer any questions.
Great. Thank you very much, Lisa. Now onto a few questions here. The company has done a great job at winning more contracts and also larger ones with larger companies that have more patient populations. Can you talk about this trend a little bit? Why is this occurring? Is the industry coming around, or Reliq demonstrating it can handle, the onboarding and has the best platform out there?
I mean, I think it's a combination of factors. Certainly, the industry is more aware of the Medicare and Medicaid reimbursement programs now than they were when we started, because the programs were very small in scope and the reimbursement amounts were very low. But really what it comes down to is, you have to spend getting into the healthcare market. It's a very, very conservative market. Clients are very reluctant to work with companies who are untested versus sort of tried and true and established. And so we had to establish ourselves as, a very clinically effective platform and something that our clinicians could get reimbursement for. So now that we have years of data demonstrating that, we are able to attract these large clients. And as we get, one large client onboarded and up and running, and they're seeing, for example, with the skilled nursing facilities we've worked with in Florida, we've actually reduced their readmissions from an average of 30% to 0%. So, we say that we're able to provide a more than 80% reduction in hospitalizations. In that case, it's 100% reduction. So, and that efficacy data, they get out in their environment, their ecosystem, and talk about it with other large clients. And then we get those large clients coming to us. Or if there's a large client we're pursuing, we can share that data with them. We can provide them with contact info at these reference customer sites. And they can get very comfortable because they are a very risk-averse market. And we certainly had first to market advantage and continue to have that. There's really no other platform that we're ever bidding against when we're going into these large clients. But what we've done very effectively beyond just being the first ones to be there is we have successfully established ourselves as the gold standard for virtual care for the chronic disease patient population. And so I expect that we're going to see accelerating traction with these larger clients as we move forward, as we continue to cement that reputation in the space.
So you mentioned, I know you recently conducted a successful financing. Can you talk a little bit about that? What the proceeds are for, why now, who participated? Was it mostly institutions?
Yeah, so it was mostly institutions. There were several out of the United States. There was one in Canada, and there was an international fund as well. But the bulk of the raise did go to institutions, which is part of why it was subscribed so quickly. And we were oversubscribed and went from sort of a 4 million target to 6 million, which is what we closed on. And a number of those US institutions are very well connected in the healthcare space, and I think will bring value beyond cash to the company. So that's very important for us. And of course, the more institutional investors we can get involved, I think the less volatility we'll see in the stock longer term. And the reason for the timing on the raise was really the most recent contract we signed with the physician network that has over 300 locations across the US. We really just kind of hit a point where we were going to be beyond our capacity to deploy for that large client as well as the others with our current infrastructure. So, we will be cash flow positive in early 2024, and we'll start to throw off quite a bit of free cash, later in the year in 2024. But you don't want to go to, a really marquee client and say, oh, we'll deploy with you, just give us 4 to 6 months, because we need to save up some cash so that we can resource, your contract appropriately. So it was really important for us that we demonstrate to these large clients that we were capable of scaling quickly and that we could meet their needs. And I think that's going to be extremely valuable for the company. We expect that this will generate a significant new amount of new revenue for next year. So it'll be, essentially accelerating our revenue generation. So I think that will more than offset any dilution we have now. It also gives us the ability to now convert anyone who was on an option-based commission or compensation plan as a consultant. Those will all be in cash. So, we'll offset any dilution, that way as well. But I think it was a question of kind of striking while the iron was hot. We had a lot of interest and people had been approaching us regarding a raise for probably 9 months. But this one came together with investors who I think can add a lot of value to the company beyond just cash. And it allows us to meet the needs of our clients. We've attracted more large clients who are more geographically dispersed more quickly than we ever really anticipated. So it's a good problem to have, that we need to grow even faster than we could have imagined. And I think ultimately that's going to really drive a lot of value for shareholders.
What are some of the key accomplishments Reliq achieved in 2023 that you're proud of and are important to share with investors?
Yeah, I mean, I won't relist them again when we talked about recent milestones in my presentation, but I think, what we're really proud of is the traction we have gotten with the large clients, which is not to devalue in any way our, initial client base of these smaller individual physician practices and home healths, but it's a monumental milestone in healthcare to, as a relatively small company, and particularly one based outside of the States, to be able to attract these clients who are parts of Fortune 500 companies, who are among some of the largest healthcare organizations in the entire US. It's a real testament to our value proposition and how well we've designed not just our platform, but the company, the whole business model, and specifically for this proactive, preventative virtual care for chronic disease management, and in particular targeting Medicare and Medicaid, which is a huge patient population. There's 140 million people in the States who are covered by Medicare and Medicaid. So, that's an almost limitless market. But, it takes a long time to kind of generate the data and build the relationships and reputation in the space. And we've been working on that since 2018. And I think this was the year that really came to fruition, that we really started to see this rapidly accelerating traction with some of the marquee healthcare providers in the United States. And that's been, it's been our strategy and my vision all along, but it's still in some ways is surprising when it does finally happen. So that's been something that, I'm very proud of. And certainly, my team is very proud of the work they've done to make that happen.
So year to date, you've announced some excellent wins. How should an investor think about these patients being onboarded? Are evenly per month, or there's a ramp towards later in the year? Meaning something signed today, how long can it take before all patients are onboarded?
Right. So as an example, the physician network that we recently announced, we're going to get started with them this fall. Not all clients are ready to get started instantly, but some are, and that's a wonderful thing. And they have roughly 100,000 patients that we'll be adding to our platform, and we expect that will take us till the end of 2025. So we are talking about very large patient populations with a number of these clients, but they will all do phased rollouts. So we've always talked about how we stage rollouts based on customers' preferences. They like to start with maybe one facility in one particular state, and then gradually expand so that they're adding, instead of one facility a month, they might be adding multiple facilities in multiple states every month as we move forward. So it's definitely back-end loaded, our onboarding. But the important thing to remember is we've never lost a client. We have occasionally, early on terminated the occasional client who was a challenge, but maybe not playing as nicely with Medicare and Medicaid as we would want them to. So we don't have any tolerance for playing fast and loose with the regulators. But we've never had a client who said, I'm not happy with the platform or what it's doing for my patients. So we have very high confidence in the projections we provide for the longer term totals around deployments. And it's they're back end loaded, but we have a very high degree of confidence that we'll reach those numbers. So the revenue potential for this company over the next 5 years, we would certainly expect to be generating hundreds of millions in revenue a year once we have even just the existing contracts fully deployed.
You continue to provide hardware for patients, but at some point, the software revenues will supersede the hardware. Do we know when that is anticipated, or how many patients are needed to onboard before in order to accomplish this?
Yeah, it's not so much the number of patients, it's really a question of how many clients actually want the hardware and need us to supply the hardware. So, if we have a client who has their own hardware already and that they've deployed to patients or want to procure their own hardware themselves directly, then, that obviously eliminates the need for us to procure that hardware for them. But generally, once the software revenue builds up, so after the hardware has all been deployed, we would typically expect that within about 6 months of the hardware first being deployed at a given client, you could start to see significant increases in the number of patients onboarded, trained, fully adherent. And that's where you'd really start to see the ramp in the software and services revenue. We anticipate that by the end of 2024 calendar, roughly 80% of our revenues will be from software and services, and only 20% will be from hardware. And of course, at any point, if we sign a new large client and they place a huge hardware order up front, it can skew that those percentages, but that doesn't mean that we're not generating at that point, a huge amount of software and services revenue. It just means there will be the occasional one-off large hardware order that may temporarily kind of reverse that split. But overall, we expect over the long term for the business that 80% of revenues will be software and services and 20% will be hardware.
Can you discuss the new markets you're developing for the iUGO? The company continues to add more new markets. I think the most recent one was pediatric patients. Maybe just describe how versatile the platform is, and are there other verticals that we might see this applied to?
Yeah, I mean, there's market segments we're in now that I think we hadn't anticipated when the company was in its infancy, but we did fortunately have the foresight to build a very flexible modular platform so that we can be extremely responsive to the needs of the market. So pediatrics, that was something that a client came to us and said, we have these pediatric patients, they really need monitoring even more than the adults, because pediatric diabetic patients tend to be much harder to control in terms of fluctuations in their blood sugar. And they're looking at living with this disease for a lifetime. So it's really important that you get that tight control as early as you can to prevent long-term organ damage and blood vessel damage and things that really create a lot of complications when they're older. But it's really, we're to a large extent, very opportunistic in terms of the new markets that we pursue. So if a client comes to us and says, I have, and this has happened, a lot of chronic pain patients, and now Medicare and Medicaid are covering remote therapeutic monitoring for those patients. So, and we'd like to use your platform for that. Then, we can quickly, within a matter of weeks, deliver a module that will meet their needs. And so we don't necessarily know what other new markets we'll get into. It really depends on where Medicare and Medicaid go with their programs in terms of scope, and other types of clients who come to us, as we become more and more well known, and have their own visions for how our platform would work for their application. But the benefit is we do have a very flexible platform and a very flexible, nimble company so that we can respond to those new opportunities.
Do you have any update on adherence with regards to getting patients to be compliant with the IUGO system?
Yep. So we expect, as you know, we took over adherence from all existing clients, and in all of our new contracts, clients have to allow us to manage adherence because we have the resources and the experience to do that effectively. So we expect by the end of the year, we'll be close to 70% of the total patient population is fully adherent. As we move forward into 2024, and we have more and more patients coming online from the larger clients who are very helpful in terms of adherence, they tend to have rates of adherence that are above 70%. So, I think we'll see that number continue to improve as we move into 2024.
A couple more questions here. Back in July, the company announced it had successfully deployed integrated artificial intelligence, AI, machine learning, ML solutions with 2 key IUGO care customers. Can you please elaborate about the services you're providing, what type of economics these deployments can offer, and how these services will continue to be desired, especially as more data is captured?
Yeah. We think of artificial intelligence and machine learning less as kind of a new product and a new profit center, but more as a competitive differentiator for us. So particularly with the large clients, being able to look at that population health data from their own patient population helps them maximize efficiencies by triaging. So essentially predicting which patients are the most likely to represent the greatest risk of any kind of complication or hospitalization, and allocate their resources accordingly. So I think they're really critical advantages or tools for us in selling the platform to particularly large clients. Some of the clients that we have using them now, so the one clinic, the cardiovascular clinic in Baltimore that's affiliated with Johns Hopkins, and they're using their own patient data set and our AI and machine learning to help predict which of their cardiac patients are most at risk of developing complications, not based on, sort of just the standard risk factors, but looking at holistically all of their patient data sets and medication and all the different parameters that they're monitoring to try to help them identify groups who maybe don't fit the standard risk model, but are nonetheless ending up with these cardiac complications. So every client will use AI and ML differently, but we think having it is really going to become kind of the price of admission as we move forward in healthcare. That may take a decade or more to happen, but we do try to really be at the forefront in terms of enabling technologies. It's why we rebuilt the platform on the FHIR standard for interoperability starting last year. So I think artificial intelligence and machine learning are going to become more and more important to clients as we progress, and certainly having that capability in the platform will better allow us to monetize our broad patient population data, because we'll be able to kind of slice and dice that data any way that any client would like us to when it comes to licensing the data. So however they want to, whatever data they want to see, however they want that kind of parsed and packaged up for them, our AI and machine learning will really help with that.
So before we conclude, anything else you'd like to say before we end the discussion?
No, I think we're very pleased with the company's progress this year, and we're really looking forward to 2024 and being able to continuously share the results of our growth with our clients. We're profitable now, fully EBITDA positive. And we've just closed on this raise, so we have a nice healthy balance sheet. So I think we're very well positioned to take advantage of the traction we're getting in the marketplace. And I think that's going to make for a very exciting foreseeable future for us.
Lisa, thank you very much for your time today. We greatly appreciate it. To anyone out there that's not already signed up for a one-on-one, again, please send me an email at lowensteiner@lythampartners.com or visit www.lythampartners.com/virtual and click the one-on-one meeting request button. We hope you all have a great conference. Thank you.
Thank you, Adam.